Hello, everyone. Welcome to this quick presentation. So, I wanted to go over a few things because I've gotten some questions from former clients or even current clients, and also people from my community who are asking me, "Hey, we've heard about some layoffs. Actually, it's not many people, but still, I wanted to address this." But anyway, they were saying they had about some layoffs for certain hospitals. Some actually are not even in some of the trackers I'll share with you later. But what I mean is that it's not like a big thing happening. In fact, as I was doing some more research, I was lucky enough that I found a resource that I follow. I didn't know they had a tracker. So they just add to it, every month. And they started this in January. Um, and it's not like it's a ton of hospitals. They're just different hospitals, either doing restructuring or letting a few people go, some more than others. And um, they're there are different reasons for this. So this is what this video is going to address. What are some of the reasons that are causing these layoffs or restructuring at the different hospitals? Okay. And mind you, here I'm talking about hospitals. So it's not necessarily like other vendors, in other words, other companies that actually are working on different innovative solutions or different, healthcare, anything to do with healthcare. The reason for this is that there are not many. However, there are hospitals because some of the people who have asked me interested in getting jobs with the hospitals that are closer to where they live in the different states. So that's the reason. In my state, I really haven't had anything. I would have had, but I haven't. But anyway, so let's get going. I just wanted to do that short intro with you. And this won't take long, but again, I thought it's important. So, what are some of the things that are causing these layoffs? So, as you can see here in the image, I wanted to talk about like, yes, there may be some layoffs in different hospitals or healthcare systems meaning hospital systems or hospital organizations rather that consist of many several different hospitals that make up the system. That's how it's called in the healthcare world. And you find that even though there is that, there's also other other opportunities happening. Actually, big investments are going into health innovation companies that are creating these new solutions. Many are using AI with the innovations, but also a few are not. However, majority are using AI. As I've said in my prior some of my prior postings or information I share online is that despite the fact that there may be, you know, despite the fact that there may be some of these layoffs, you find that within the health ecosystem, there are many other opportunities actually that exist. So that's the case I'm trying to make here. And as you can see, the image here, these are not the only areas, but certainly they are. They make up some of them. You see IT, data, clinical tech, product, data, this has been repeated, marketing, sales, and also other areas. Okay. All right, so moving on. Um, Let me go to the next. So, what are some of the causes of these layoffs? Those are the things that I'm addressing here. The first one is uncertain federal policies. I think by now we all know that there have been so many changes, layoffs in different industries. It's not just healthcare. In different industries, different sectors, fintech, all of them, where they are creating or have created different policies, and some of them we all still don't know where things stand because maybe a rule or a policy is signed, but it's not implemented or it's um, is postponed like a couple of days or couple of months. And so, what some of these organizations are doing, they're just looking. Imagine if you're a CEO, you're just looking, you have to look far ahead to anticipate what's coming from the data you have currently, either the data, the news, or what you're seeing in the world, either in the economy, the geopolitics, the geoeconomics, just generally economics and things like that. So that's what some of them are doing. All right. And again, I want to emphasize these are not many hospitals. And also, these hospitals are all not doing this in the same month, like August. Like I said, the main resource I got this where these are tracked. They did this from January, so if of this year, because apparently they started, I think last year, where they kind of do a tracker, and the tracker is not like this special thing. It's just a blog. When they started, they kind of put the most recent at the top and the ones that have been in the past, at the bottom. So it's fasting at the top, and then no, sorry, fasting at the last and the bottom, and then lasting at the top. Okay, so meaning they show the most current. So here, I did say several hospitals because before I was going to put one hospital, and I said, you know what, I'll just put several. But when I say several, it's not a ton. It's literally two here. And actually, there may be a few more because they tend to give different reasons. Like due to the policies, we're not really very sure of what's going to happen. So they're just really repositioning themselves. So we have UVM. This is University of Vermont Medical Network. It's in Vermont. And then Central Care in Minnesota. As you can see, with the federal policies, many are affecting like government insurance, which entails Medicare, Medicaid. Okay. Then we also have mergers and acquisitions. A good example, these are not many because most of the hospitals really, this has happened in the past. However, there are still some that have merged together because they're trying to grow bigger healthcare systems or in terms of management for those maybe who may have worked in healthcare for some time. It's when you, what actually create, let me just back up a little. What created the hospitals to start merging together is because this started back in around 2011, okay, and is because again of the changes in reimbursements. All of this is reimbursed. This is not new. This has happened and under different administrations. So I'm not, by the way, putting politics in this, but I just want to explain. Okay, so and so the hospitals started merging to work together because when you have a bigger population of people, it makes up that at least you can make up for the amount of reimbursements, meaning the amount of money that's paid out. Okay. It becomes a better thing. It's like, someone maybe who wants to grow, if you have a business, that if you're growing and then you're able to get more revenue, or you could even get money through loans and stuff like that to help you grow. You'll grow if you have more help, meaning you have more employees or people that you're working with, and it will grow the company. So it's the same kind of logic, okay? Versus like, say, if you're solo or one person. I'm not saying one person can't grow, but there are those, it depends on the level that they want to grow. You want to grow bigger, as again, this is an analogy, okay? You may want more employees. So it's kind of the same thought process behind this. So here, the one that has done that is Mass General and Brigham and Women's Hospitals. They're both in Massachusetts. I didn't put that there, but anyway, they're both in Massachusetts in the Boston area. And they're very well known, especially Mass General. It's one of those that appears alongside as US US News tends to every year to rate hospitals, Mass General is at the top with either Mayo Clinic or John Hopkins. Those tend to be the top hospitals. All right. So they had already actually merged, but they hadn't finished, I think, the whole merger. So they decided now to do that. And as you know, with any merger, sometimes there's duplication. And that is the reason that they've let some people go. Now, I was going to say the numbers, but I don't remember the numbers. But they were in the hundreds, actually. They weren't in the thousands or anything like that. And for some of these, as I'm giving examples, by the way, they do say that some people are going to be moved into open roles and things like that. So the numbers could even change, meaning that they are not going to be as many as has been reported, because eventually, if someone is given another position within the company, that's what happens. Okay. So 3 is cutting administrative roles. This is where some are removing leadership hierarchies, and then others are administrative roles, meaning either support roles or things like that. So where this is happening is, as you see here, Children's National Hospital in Washington, D.C., the capital. And then also Blue Cross Blue Shield of California. BCBS is Blue Cross and Blue Shield of California, and then another hospital called Metro Health Systems in Ohio. What these are is usually, like, especially administrative roles, could be where some of the roles have been, they didn't mention this necessarily, but it could be technology, or sometimes, as again, it could be that they're reducing this, again, looking at what's coming forward. A good example is many of the hospitals, the one that have, it's not the only system, but many hospitals in the US use the system that has a bigger market share, which is called Epic Systems. Okay, so all these EHR systems, which are the electronic health record, they keep our charts and all of that electronically, other than paper, how it used to be, is that they're implementing AI. However, it's not going really as fast because healthcare is very complicated, and there are many things that have to be put into consideration. So it's not like all of them are letting people go or anything like that. But again, like I said, they're anticipating what's coming. So that's what I think. When they have other reasons, they are like, okay, let's just do this as this is coming. And sometimes it's also in order to let up capital. Okay. Especially if they're going to bring in new technologies that are going to help to either automate or just make things better. So those are some of the reasons. The 4th is PE mismanagement. PE is really private equity mismanagement. Hospitals in bankruptcy, whereby I won't go into the system, but I do have some of the resources there, and I'll be showing you what those are. Anyway, so where the hospitals have been mismanaged by private equity, this is pretty common. It's not just in hospitals, it's actually in other areas. And you find that the hospitals are filed for bankruptcy, and what happens is that they're slated for closure, and so they tend to look for buyers. And if they're not buyers, then unfortunately, some may close, or others will get buyers. And so because the buyers are trying to restructure to get from under the company and what's going on, they may let people go, in other words, in order, excuse me, to make sure that they can actually make that hospital still viable, meaning making sense, because, I mean, you have to have at least some profit when you're running a business, even though, they're caring for patients or people, it's still a business. So if that is not most so the business also is that you have to pay your bills. Okay. And when you pay your bills, you have to at least leave some money for different reasons, okay, to ensure that you have some money that is there in case things happen, and also in order to pay your bills, and also as a profit. Okay, so that's the thing. Here, I give an example. I live in state of Texas. Okay, sorry, I used to live in Texas. I live in the state of Connecticut, and there's a prominent PE company called Prospect Medical. They've caused so many, unfortunately, pain here. The hospitals haven't closed, thankfully, but the same has happened in Pennsylvania, where the hospitals have been forced to close. So here, unfortunately, one of the larger known hospitals was going to buy it, and then they found things weren't working. So the state has had to step in, and they're actually making laws to prevent anywhere, any private equity from buying any hospitals or something like that in the what do you call it, in the state. Okay, and there's more information here. I may actually share these slides if people want. But I'll have to, what is it? I have to create where you can enter your email so that actually it's sent to you. Okay. So that is what will happen. All right. So moving on to the next. Again, moving on, we go to number 5. The others actually are, again, this is looking ahead. So they've decided that, you know what, they're going to outsource some of the roles, which are called outsourcing back office roles. And these are some of the things I talk about. Back office is whereby these are non-patient facing, and they're really in different areas. So we find that there's a lot of work. Listen, when you go for an appointment to your doctor, there's a lot of work that's done behind the scenes that many people may not see. Like if you're not really within the healthcare system, you may not know. In fact, even when you're in the healthcare system, you may not know all the things that happen. But anyway, I do know because my consulting background. And also, while I've consulted some companies, we've had to look at some of those systems and try to see where things can be made better. So I do know what some of those are. But some of the areas is here they say they had to do that mostly with the people who are working remotely. Okay. And those people were covering back office roles. And this included things like insurance pre-authorization, meaning that if you make an appointment, for example, there are people actually, you do remember if you maybe call in to make a schedule an appointment, they'll ask you for your insurance. Is it still valid? Is it, that kind of information, your demographics, your insurance information, demographics, and all of that. The reason they ask that, because behind the scenes, there are other teams that actually have to go in and look at your insurance and say, okay, how much do you have to pay when you come for this appointment? How much will the insurance pay? Okay. And then you find that sometimes they'll tell you up front if you're checking in that, hey, you have this co-pay or you have this co-insurance. Co-insurance meaning the insurance will cover only a certain amount and you have to cover the rest of it. Okay. Co-pay is that pay that we go in and pay as we check in, which is a little bit different from co-insurance. Additionally, there's also things called like clinical documentation. So this is mostly has to do with what notes the doctor will write down, because from those notes is how they determine they call it coding, how they can code, because in order to be paid, there's a universal language certain codes in healthcare that have to be used according to your current condition, the diagnosis that's been made, and things like that. So behind the scenes, there are people that do the coding. However, these are some of where the innovation is happening, just so you know, by the way. So you find that they're trying to make it where it's automated. So there are certain new companies that have come up that are trying to automate all this using AI. So those are some of the things I was saying. I think they're anticipating some of that because they may use some of this technology. Okay. The other one is billing. This is a very involved process. In fact, there's several different layers to billing, which I'm not going to go into, but billing in the finance offices of every healthcare organization is very, very involved, and it has a lot of stuff behind the scenes. that help with that. Okay, because you have to deal with before actually the claims sent over to the insurance company, and then when the insurance company sends back whatever results they are, they're going to pay for some, they're going to deny some payments, or they're going to reduce some payments. There are people that have to go in and look at some of those things. Okay. Then also where they post payments. And then, there are people that have to follow up if maybe a patient has to pay and things like that. So there's a lot behind the scenes that happens. Okay. And that entails a lot of people. So they may want to reduce that. So example here was Jefferson Health in Pennsylvania and Adventist in California. Those are the two. I think it's the only ones actually, so that say they're going to do back office roles. And there are certain companies that do these that take on this as a business. They help the hospitals where the hospitals will outsource those roles or those tasks over to these companies. Okay. And I won't go into the example companies, but I do know some that are known in the industry. So that is what happens there. Okay. 6 is administrative insurance costs. So there are some that were saying that it's funny because one of them is already an insurance company, which is here, BCBCS. So BC is, like I've said, is Blue Cross Blue Shield of Michigan. That's an example. This actually was a few months ago. Like I said, this is from January. It's not necessarily, excuse me, it's from January. It's not necessarily that it's happening now, but that's what these are where they're giving those reasons. Um, they're they're saying that because increase in pharmaceutical drug costs, and that's a big one because even though the insurance company may have that, they may not necessarily have the bargaining power for pharmaceuticals. Okay, pharmacy has a whole other big deal of how they do things, and it's been a pain actually for some, and there's some people trying to um, solve those problems. One of them is the billionaire Mark Cuban, if you know. He partnered with someone who started a pharmacy. I think it's called GoodRx. And if you go like on LinkedIn, you'll find it if you look for it, or just look up Mark Cuban, you see that he has it in his profile. Okay. But anyway, so there's what they call the PBMs. They're like middlemen. Okay. They're the ones that go in between the manufacturers, and then they're the ones kind of who set those costs. And unfortunately, by the time they reach to the, let's say, the CVS, like the pharmacy companies, I'm giving CVS as an example. Anyway, the pharmacy company, the cost has gone up, and you find that, these costs are going up. So these people are looking and saying, I think because of the benefits and all of that that we have to pay out, let's find a way to reduce the cost. Again, looking ahead, because some of the companies, they're not going to use the calendar year. They're going to use a fiscal year to renew the insurance. And for many, this fiscal year tends to start around July 1st or something like that. Okay. When it ends in June, or sometimes I think it's June 1st or July 1st. Okay. For some. Okay. Depending on what it is. So you find that many have, who apparently are 50 years and older, they've asked them for voluntary early retirement. Specifically, that's exactly what they said. Voluntary early retirement for people that can't take it. Okay. And I think they want a specific number. So I have a feeling that, there's a way maybe they will entice people to do that, because they also do take on those costs because they have to compensate the people who are taking voluntary retirements. Okay. If they're there. Or qualify whatever the rules they put in place. So example, like I said, Blue Cross Blue Shield of Michigan, Humana, these two actually are insurance companies. Based in Kentucky, Blue Cross of Michigan is Michigan State, Central Care in Minnesota. Okay. Number 7 is the adoption of innovative technology. So the only one Do you see that? This is funny. The only one that was given an example is Adventist Health in California. They're the only ones who gave that as the reason. Um, I didn't see any that gave necessarily a reason as AI. And I'll say this, that within healthcare, there's quite a lot to do. However, the automations are going to be in certain areas. And sometimes it may not entail like people have to be let go. Sometimes it might. Sometimes it's enhancing actually the work that people are doing. Okay. So that's what happens. Let me just drink some water here. Okay, so that's what we have. For sure, as I said, within healthcare, it's not like, the big tech companies like you just install the AI. Healthcare as an industry, there's a lot entailed behind the scenes with its data. Okay, they have to follow HIPAA, they have to follow certain guidelines, you have to be very careful. So even though they're kind of working behind the scenes, not kind of, they are working behind the scenes. They're not pushing it. You don't just go out, willy-nilly. So that's why it takes a bit longer. And so that's why you see like here, I really only saw one that said they're letting people go because of the accelerated adoption of innovative technology for AI. Okay. And these guys may have probably used several companies and you don't know. Because one of the things I found out is Epic. I'm using the larger one because sometimes it's a representative of what the others will be like, how they're operating, especially that they have the funding and all of that. So anyway, Epic is the bigger one, so I'm giving it as an example, is that they also are pushing within their systems. And imagine when you have a system that manages so many areas. This took a long time for them to build the EHR, Epic, many years ago. Okay, I think 73 is when this lady founded it. It's still private, by the way. The founder, Miss Faulkner, based in Wisconsin, she doesn't want to take it IPO, meaning on Wall Street and all of that. It's privately owned. But the thing is that what they have done, I think they may be also putting some AI within some of the modules or applications, but they mostly partnered with the current companies, okay, that have created solutions within the whole workflow of healthcare because there are many areas that that can be applied within AI can be applied within. And so I think it would be a very big task because also many things you have to be careful because AI is very dependent on each other. So many areas, if you're not careful, like you may have your system that's stable, and then you add this whole thing, and then it messes up downstream, some other process. Okay, so they have to be very careful when they're doing that. And so what their strategy has been is that they've mostly partnered with other companies that are creating these solutions, even though I think in the meantime, they're also creating their own solutions, especially in specific areas. Okay, that's the strategy that I've seen. And so with that said, you find that what I want to talk about, that those are some of the main problems. I mean, sorry, not main, those are some of them, no, those are the main reasons, actually. And I looked around, I did some research for that, and that's what I found. So meaning that there's not many other reasons. And so even though there's some that, oh, maybe there's one other reason, sorry, I forgot to add, is there was one hospital based in New York City. They let recently a big number of people go, but it was because of a lawsuit actually of a provider who apparently was abusing people. It was a he who was a GYN. and was sued and all of that. I found that recently as I was doing my research. I forgot to add it, so I'll just say that. Um, maybe because of lawsuits, if there was a lawsuit, okay, that may cause also because it was a lot of 700,000, 724 million something, million. Imagine 724 million to pay out. It was a class action suit because there are many patients who also apparently joined this suit. And so you find that they had to pay that out and all of that. So they did leave let a good number of people go, apparently. So those are really the main reasons. But with that said, what I wanted to emphasize is that I want you to get an idea that there's a whole big ecosystem. I call it an ecosystem, in other words, healthcare. It's not just hospitals. And I've said that if you go and look at my LinkedIn posts, I've said that recently that it's not just the hospitals really where this that make up the healthcare system. It's so many other areas that make up the system. And these are some of the areas. You're going to have the hospital and care delivery centers. So by care delivery centers, what I mean is any other centers actually that do deliver. They may have, I think you've seen urgent care, for example, locations, outpatient surgery centers, maybe outpatient also delivery as in women giving birth centers, things like that, okay? And also maybe actually outpatient hospital locations, because some of, at least in my state, and I know in where you live also, some of the hospitals have created these other locations where there's a group of doctors that are providing services within certain areas, general areas or towns. And so you find that those are quite a bit. So those kinds of areas, sorry, facilities, okay? So you have medical groups and private practices, you have clinicians, support departments, and allied health staff, all right? All of those. Meaning these are areas that people can get employment or job opportunities. You have insurance, health insurance and payers companies, pharma and biotech, health IT and AI-driven innovation. These are the ones I talk about a lot that are separate from companies. And these would be vendors. These are, for example, the ones I was giving an example that Epic has, for example, partnered with, okay, to provide those solutions within certain areas within the workflow, because the workflow is quite big. And I'll be talking about that soon. Oh, maybe I did a video. I think I might have. Anyway, if not, I will be doing a video on that soon just to give people an idea. Okay. Then we have medical devices and equipment companies. We have telehealth and digital health startups or just digital health companies. We have supply chain procurement and logistics, environmental services and waste disposal, public health agencies and non-profits. We have healthcare consulting firms, those kinds of things. These are all opportunities where people have where there are currently job opportunities. Okay. So meaning that even though you hear about jobs loss, do not lose hope. The healthcare is still here. It's not going anywhere. There's still job opportunities. One of the fastest growing, they talked about that, where are their jobs? Okay. Now, some areas may have slowed down because maybe they don't need as many people. But within these areas, there are also those where they need help. Tech is a big part of this because of the innovations that are being done. When I say tech, it's any kind of technology that's helping to solve for or find new solutions in these areas. Okay. And so also, just because I'm saying tech, I'm not only saying tech, people in tech are the only ones who get these jobs. What I mean is, as a company, you have all these different departments within those companies, okay, that people can get jobs. All right. So here I have just really a high level overview of what that looks like. This is very simplified. But what I wanted to show you is, at a minimum, the three areas, okay? of workflows within healthcare. You have the patient onboarding, then you have where patient is provided services, and then the payment systems until it gets back to the provider, someone who is providing those services. Okay. And these are many different types of providers. So you have healthcare and health AI or innovative companies, and each is a health solution. So these here at the top, okay, they point to a solution at here. These are vendors, by the way, these represent vendors, but they point to providing solutions, additional solutions to a healthcare organization. I'll give an example, either a medical group or our hospital in this case. All right. And here, the traditional all-in-one are the big, here's where I'm giving some examples. The bigger health platforms or health systems, meaning examples like Epic, like Cerner, Meditech, okay? And the third party is here in each case. For example, the first one here would be Availity. Availity helps with pre-authorization or for patients. Okay. Making sure that you have the insurance, how much is that, and all of that nice stuff. And then you have here provider services, 3M. It's a known company with coding and all of that documentation. It helps with that. Okay. And then Experian here will help with the billing. Behind the scenes is what they call rules. Um, so by rules is that it's catching the problems before they actually sent out to the insurance company, because the insurance company, if they have certain rules that, hey, we're going to pay this amount and this has to be coded a certain way, this company has to be able to find any claims that are preparing to be sent there that don't have those things in place. And so it will catch it, and then people will go and make it right. All right, that's what that is. Again, this is very high level. And then you have those also third-party vendors that they're with between in here, okay? Here, when the patient is onboarding before they get actually to the provider services, that they're doing something within here, okay? Same thing. After the patient gets the services, before they send them to payment, there are companies in here or solutions, software solutions that actually provide or help with those kinds of things. And also same before the process, after the payments are sent, either the payments are sent or they're denied, whatever that is. But before they get to the provider, you find that there are also third-party companies in between here. So my point is that there is so many companies here where there are opportunities for that. Okay. And here the supply chain, I wanted to add that as one of them. This could be supply chain, actually, it could also be environmental services. They kind of span the whole breadth of the workflow from beginning to almost not to the end, but to some part of here to the end. But even supply chain, you have to be able to make those payments. Okay. So here, supply chain, a good example would be like pharmacy. All right. It's kind of as a sub of a supply chain, but in order to get those, medical drugs that people have to take, let's say example, an appointment has been made, okay, for an outpatient surgery. Okay, they have to make sure that do they have the bandages needed? Do they have the medical medicines needed? Anesthesia if it's going to happen, or any other, medicines, the materials that will be used in that surgical center. So you find that it starts from the beginning here, and then the patient is given those services, and then they have to make sure that these people are paid, and also that in the system it's accounted for. Okay, they'll have the patient pay for those services, those materials, but it's also accounted for to ensure that, okay, we know that this is how much has been used and this is what we are remaining with, wherever the storages are. Okay. So you see what I mean? And so here, supply chain, one of the examples they give the companies would be McKesson and Cardinal Health. These are two different companies, okay? So that's where, that's what I wanted really to emphasize for you, that do not be afraid that, oh, I've had maybe there's a layoff here. Is this happening all over? No. And there's so many hospitals, for Christ's sake. So if it happens at one hospital, trust me, they still need people, by the way. Even though it happens, please don't get discouraged. In fact, at a hospital near you, they usually are still hiring. They may have frozen in some areas. That's pretty normal, but sometimes they have to stop the hiring in order to regroup and say, okay, if we've let these people go, if we are leaving these people go, what do we have remaining and where do we still need? So they'll still hire people. Okay. There's always a need. So please don't get discouraged. So here, I just provided where some of the resources are. Some of them are policies, or you can read further actually. I wanted especially to include a page for CMS. This is the official government federal page where there are policies and regulations that have passed. There's one there dedicated for that. And then here, the Federal Register, CMS rulemaking. These are ones that what is it? They also kind of guidelines and things like that for the different states. And then we have Medicaid. This is the insurance for the government, Medicaid.gov, because there's Medicaid, Medicare, and also it has policy guidelines. And then there's one also that kind of tracks, not kind of, but it does track any approvals that have been said. And when I looked at that, what I found is, for example, are they going to provide for addictions? Are they going to provide insurance or benefits for people if the hospitals or the facilities that the people are at can file for some of those benefits to be given? Okay, so those are the things. So this website just tracks that. It's independent, it's not part of the government, but it just tracks which states or, things have been approved or not approved and that kind of thing. It's new to me. I just found it today, but because it's Medicaid, they just want to show at a thingy level, they collect the information and show what that is. And then here is where I found the Fierce Healthcare. It's called Tracker. The the link was so long, so I didn't really put it. But anyway, that's where it is. Fierce Healthcare is a tracker. It's a website, but it's more like it's a collection of news, like a newsletter website, collection of what's going on type thing. This is where the hospitals are. So like I said, they're not hugely many, but they've been tracking since every year. So since January. But it's not like all these are like the examples I gave. It's not like they're all happening right now. This is just through the months. We're in month eight. Oh my goodness, the year is going quickly. Okay. All right. So that's me. This is also to do with private equity. I did put a bit more private equity because I want people to read up on it. If you're, again, like I said, if you're interested, I'll put a site where you can enter your email and then this can be sent to you automatically. Okay. I have to set that up so you can get that. But anyway, just examples of hospital mismanagement. I think this in particular was Penn Capital. So this was in Pennsylvania. It closed this year, unfortunately. And then here, this one is in the state I live in, Connecticut. Excuse me. Let me go back. This state I live in, Connecticut, there are three hospitals, but in particular, I didn't put what has gone because there's been many things. It's been in the news every time there's something that's happening. It was going to be bought by another large hospital system here, and they had to stop because apparently they found some things. I won't mention the hospital, but it's an Ivy League hospital system here. It has an Ivy League university. If you want to guess, you can. Anyway, in the state of Connecticut, they do have a hospital system also. So what happened is we have one of the senators in the Senate, the federal Senate, that is, his name is Murphy, Chris Murphy. They're passing some law here in the state to try and stop private equity because they've really done some harm in terms of that. And it will really be devastating when they close these hospitals because these are community hospitals. They've been here for a long time. One of them actually is not far from where I live, and it would be devastating. But luckily, there's another hospital there, meaning that if the worst comes to the worst and they have to close, at least there'll be one hospital. But this is a large, large community, and it has also surrounding, like it's when it's a greater part of a metro area. Um, it's one of those. And so you have like you see that there are many communities that go surround this town that's big, okay? It's a city, actually. It's not a town. It's a city that many towns around it that use that hospital system. So you find that if it closes, it will be devastating to the town. Even though luckily we have two, so there's a second one. Um, but hopefully it doesn't happen. The others in the other towns also, they're major. I think they're the only ones in some of the other towns that I do know about. Anyway, and then there's another short video here where Senator Elizabeth Warren, she's a senator from Massachusetts, but it's actually a short video. She's talking about PE and how that happens, what they do in order to literally, unfortunately, do this to different businesses, not just healthcare. And it's all been devastating. So she gives examples there. And so that's what I wanted to also include in there. And if you want, you can actually go also Google her or go to YouTube and just do Senator Elizabeth Warren short about private equity. You're going to find it because that's what I did. Somehow one time I found it or someone sent it to me, and then to add it here, that's what I did. Okay. So hopefully this was helpful for you. And let me just get out of the thing. Hopefully this was helpful for you, and really just to show you that even though you hear about a loss of jobs, don't lose hope, or don't give up if you want to actually pivot into the healthcare industry. Okay, I would love for you to join. These are the services I provide, and to help people, pivot into healthcare tech. Again, when I say healthcare tech, I don't mean that you have to be someone doing tech, but rather a company that is working with healthcare tech because they need different roles. And please do check out the rest of some other videos I've shared on my channel, YouTube channel. And if you found this very helpful, which I hope you have, please share with someone that you know, and also be really helpful, please. It's helpful for me when you subscribe to my channel. What happens, it tells other people that, oh, people actually like this material or this information content that's being shared, and so they end up sharing it to other people. Okay, so I would love, help me grow my channel. I'd really appreciate it. I'm now I'm now really asking for your help here. Please, if you find my channel information helpful, do subscribe to it. Okay, I really thank you so much, and thanks for being here.